Welcome to the JBI podcast. I am Dr. Nneka Chukwu, a quality nurse consultant with Kaiser Permanente. I am also an assistant professor at the University of San Francisco in the graduate nursing program. I have over 20 years experience in nursing spanning from medical surgical nursing, critical care, telemetry, maternal child health, academia, quality and risk, and leadership. First, I want to thank Dr. Scrooge and Brawling Cox for their support throughout this process. I also thank JBI for giving me the opportunity to share my thoughts through this platform. I will be discussing the manuscript by Mata Tesame et al. Titled Compliance to Antenatal Psychosocial Assessment Practice Among Midwives, a Best Practice Implementation Project. As an advocate for women and children and a mother who experienced complications during childbirth, I have a deep-rooted passion for improving care outcomes for pregnant women and their babies. Maternal mental health assessment is an aspect of obstetric care that has started to gain traction globally. Studies have shown that depression during pregnancy has a significant impact on pregnant women and their babies. Examples of effects are failure to care for oneself, including loss of appetite, spontaneous abortion, preterm delivery, and low birth weight infants or infants that are small for gestational age. Historically, obstetric clinicians focused more on pregnancy and everything related, excluding the mental well-being of the pregnant mother. This outcome is more prevalent in Africa due to cultural practices and the stigma attached to mental illness. Similar to the author's findings in Ethiopia, there are limited resources available to midwives for psychosocial screening and referral both prenatally and postnatally in other countries within Africa. This study aimed at promoting a prenatal or antenatal psychosocial assessment practice among midwives. The authors highlighted the gaps in early identification and referral for psychosocial assessment. Furthermore, they established that the prevalence of perinatal depression in Ethiopia is significantly higher at 25.8% compared to the global frequency. They adopted the Joanna Briggs Institute practice application of evidence-based system model as a methodology for this project. They found that factors such as lack of standardized tools for assessment, lack of clearly defined referral system, privacy, and limited knowledge of providers as barriers in conducting this screening. As reflected in the baseline data of 0%, the midwives did not perform psychosocial assessment routinely except for patients who were previously diagnosed with mental challenges or exhibited signs of mental health disorder. However, the result of post-implementation showed that midwives performed psychosocial assessment screening at a rate of 91.5%. This result indicates that midwives can effectively accomplish the skill and improve compliance with the proper training and support. Psychosocial assessment screening during pregnancy and postpartum is a critical research topic. As a quality consultant for maternal child health, I understand the implications of undiagnosed perinatal depression on mothers and their neonates. Maternal well-being equates to neonatal well-being. The stress of pregnancy can further compound underlying mental health challenges, leading to unanticipated outcomes. To mitigate risks, healthcare organizations need to provide appropriate evidence-based training and resources such as the PHQ-9 for the care providers to ensure proper screening, early referral, and treatment. Also, standardization of practice across the continuum of care is pivotal in enhancing outcomes of care for this population. In summary, this manuscript is a call to action. The authors highlighted the opportunities in conducting psychosocial screening during the prenatal phase. Their findings and results demonstrate that given the right tool and training, care providers can effectively provide holistic care and support to pregnant women during the prenatal and postpartum phases. Further research is needed to assess the results of this project on mothers who were screened. Did the implementation of this project result in early referral and treatment for mothers who met the criteria? What follow-up processes are in place to ensure continuity of care once a diagnosis is made during the prenatal phase and as the women transition from prenatal to the postpartum phase? This evidence-based project can be replicated in other settings, especially resource-challenged Africa with high maternal and neonatal mortality. I commend the authors for their dedication to improving care among pregnant and postpartum mothers. It has been an honor to share this podcast with you. Thank you.